vaccination program.
Opportunity to be with you this evening. It is, of course, with great pleasure that we, as members of the National Health Council, wish to give some details to the public about the mass vaccination campaign that will kick off tomorrow. We know that everyone has been very anxious to know what will happen tomorrow and how we will start to vaccinate our most vulnerable citizens and then move on to vaccinating the general population. I am happy that my colleagues, the MECs, have joined me here today because they'll also each give details briefly on the provincial plans that will happen in a moment. The Sisonke program, as we had introduced it, has now ended and has vaccinated a total of 478,733 South Africans. The program received a total of 500,000 doses. These doses will not be used for phase 2 or phase 3, but they will be used by the Medical Research Council to conduct important studies and programs that will help us to understand how the vaccines work for population groups such as persons living with HIV and comorbidities, the elite athletes, pregnant and lactating mothers, and other special categories. At midnight, another 300, this is tonight, 325,260 doses of Pfizer vaccine will arrive, bringing the total of Pfizer doses in the country to 975,780 by tomorrow morning. We will continue to vaccinate healthcare workers and complete the targeted 1.2 million healthcare workers, and we've targeted that to be done mostly during the coming week. We will also begin to vaccinate citizens 60 years and older who are most vulnerable of becoming ill or dying of COVID-19. 5 million senior citizens are targeted to be completed by end of June, provided that the supply of vaccines flow as anticipated. By the end of June, we expect to have received 4.5 million doses of Pfizer and 2 million doses from Johnson & Johnson once released. The J&J vaccine, Johnson & Johnson vaccine, is still awaiting the release from the Food and Drug Administration of America, and we are constantly being updated by the Johnson & Johnson Global Head Office on the progress in this regard. We hope to get finality this week, and we'll be talking to this office during the middle of the week. Tomorrow, phase 2 will start as planned with Pfizer vaccines at 87 sites across the country. That will be 83 in public sector and 4 in the private sector. These sites will be published on the South Africa SA coronavirus website or in I Choose Vaccination Bulletin. And the provinces will also publish on platforms that they will announce shortly. We would like to just make sure that these are also sent to the media so they are available to the media. So as we say, we'll start with about 87 tomorrow. Then we want to scale this up to just over 200 by the end of the week. As we speak, SMSs are being dispatched with invitations to vaccinate tomorrow. 7,707 SMSs are being dispatched to healthcare workers, and then 4,288 SMSs are sent to senior citizens above 60 years of age. When you go to get vaccinated, you must take the proof of your ID or passport or ID card, driver's license, so that we can identify you. People who belong to medical aid scheme should also take their medical aid card or other related details. Just as a matter of caution, if you miss your vaccine appointment for any reason, you will be rescheduled. You are given another date and time to be vaccinated. But if you miss 3 appointments, you will not be rescheduled again. However, you will still be on the system, and you can then ask to be scheduled again by phoning the COVID-19 hotline or visiting the registration site. In other words, if you miss the first one, we can be rescheduled. So we just keep an orderly approach so that it makes it possible for us to be able to reach out and organize the way people are able to reach to the vaccination site. Just as a reminder, we are registering people on the electronic vaccination data system Either you go online at www.vaccine.enroll.gov.za. That is one way. The other way is using the WhatsApp line, and the number is 0600 123 456. That number will take you through to the portal. Then the third way is to do SMS. You dial number *134*832#. That's the third way. The other way is to call COVID-19 hotline, which is 0800 029 999. 0800 029 999. You can also use the new QR, simply scan and follow the prompts. So then it will show you which way to go. And the QR code will be published widely and can be found in the SA coronavirus website on the National Department of Health website. All services are 0 rated, so you don't need to have airtime or money or data to be able to use the services. The provinces, the National Department of Health, the GCIS, core teams are conducting robust registration drives, and we are seeing that the numbers are already going up, and because these initiatives are actually making an impact on the community. So we encourage more of this work, which we have commended, so that people can continue to register. We've seen a huge difference in the past few days. Today, over 1.22 million senior citizens have registered, and 914,000 healthcare workers have registered on the EBDS. This means that now at this point we've got more than 2.1 million citizens who have registered. We recommend that as many people as possible register beforehand. For tomorrow, we will not be able to accommodate people who are walking into the vaccination sites. However, as we move on with the vaccination program, we will be able to accept people who will come in walking into the vaccination sites, particularly the senior citizens who may not have been able to register on the portal. The program has been designed to avoid long queues, and that's why we would like to keep people to go in on the basis of the message inviting them to come for vaccination. This is why it's important that as many people as possible register beforehand and then follow the instructions which they will receive by SMS. For those citizens living in the old age homes, they will not receive an SMS because the vaccines will be brought to them. They will be registered and vaccinated in their old age homes, and we're targeting over 7,000. Excuse me. We're targeting over 7,000 senior citizens living in 102 old age homes by the end of the week. And 50,000 citizens documented in the old age homes will be completed by the end of May. The province will detail their respective outreach plans for old age homes. They are part of the rollout plan. Fellow citizens, you will notice that the numbers will start fairly slowly over the course of the week, and then, of course, scale up towards the end of the month. This is because we are starting off with a new vaccine that we have never used before. We have learned from the Sisonke study that the first few days start slowly as vaccinators get used to the new vaccine. Then once operators are compatible, the turnover begins to start rising. This is because, just to know how many vaccines you get out of a vial and how you draw out the requisite amount takes a little bit of skill. And in the process, once they are used to it, then of course the numbers start increasing quite rapidly. This is what we have planned around. To allow us a few days to iron out teething problems, and we expect that there will be many teething problems, and so that's why I want to start a bit slow, and then we're going to scale up as time goes on and as we resolve these problems. At this stage, you can't choose the vaccine. When you get vaccinated, you'll be informed which vaccine you are getting and if a second dose is needed. You will receive the date, time, and place for your second dose by SMS, or a card will be issued to you on the day of vaccination if you do not have a phone. Most people will get their first and second doses, will get their first and second doses at the same site. So it's much better to go to the same site, and then you get, even when you come for a booster, you come to the same site. The Pfizer vaccines are safe and work well, and so was Johnson & Johnson, even against this variant, which is dominant in this country. And after 14 days of having received the vaccine, one starts to show markers of immunity. This has been proven scientifically. There's now very good literature to show that the interval between doses can be increased to 6 weeks. The original plan was that there must be a second dose within 3 weeks, but increasing evidence has shown that, in fact, it can be increased to 6 weeks, that is 42 days, without any challenge. But the study that was done in the UK following their situation, it has shown good results after 3 months. And therefore, we are going to be getting advice from our experts who will guide us on the best interval that the citizens must present on the date they are given for the second dose. In other words, we will be giving everyone the first doses now, whilst we clear the advice. And then, of course, we will then be able to indicate which date they will be coming back for the second dose once that has been cleared. Because we want to rush to get as many people as possible to be vaccinated, the UK experience is very appealing to us. Many people tend to have mild symptoms after vaccination. These are flu-like symptoms like mild fever, headache, tiredness, as well as redness and swelling and pain at the injection site. These generally disappear within 1 to 2 days and can be managed at home with rest and simple paracetamol. If you have more serious symptoms such as severe headaches, severe abdominal pain, or severe limb pain, you should then phone our COVID hotline 0800 029 999, 0800 029 999 for advice, or seek care at your nearest clinic, hospital, or private doctor. The vaccine will protect you from getting severe COVID disease or dying from COVID. However, no vaccine works 100%, and we also still do not know whether vaccination prevents transmission of the virus. It is therefore still important to follow the standard COVID-19 safety precautions to protect yourself and those around you. The use of masks, sanitation, being in ventilated rooms, and hand washing and sanitizers. When you have finished your vaccination course, you will receive an SMS indicating that you have been vaccinated, as well as a vaccination card. Keep record of your EVDS vaccination number. We are still not certain how long the protection from the vaccine will last. Doctors and scientists are still working to understand this better, and will keep the public informed of these details. I'd like to thank the Director General for Health, the MECs, the HODs, officials in the national and provincial departments of health, private sector, business sector, trade unionists, labor, and other members of civil society, all the social partners who have worked tirelessly to ensure that we are ready to start vaccinating tomorrow. We also know that we will be joined by sector leaders who will lead by example to build confidence in the vaccines themselves and the vaccination campaign. So we should expect in the coming weeks that we'll be seeing more of the political leaders, community leaders, religious leaders, traditional healers, business leaders, artists, sports personalities, various leadership groupings in society who will be out there to receive the vaccination, so that it is very clear that we all are in this together, and therefore we want to thank them in advance for coming forward to support the program. At this point, I'd like to thank you, and therefore allow that the provincial MECs and heads of department give us briefly what is going to be happening in the different provinces. I thank you.
Thank you very much, Minister, for that update. I see people are indeed getting excited and very, very relieved to actually hear the details. So thank you so much, Minister. So without much further ado, let us then invite the Eastern Cape to come through. I think it's going to be Dr. Zwelini Mkhize, if I'm not mistaken, the HOD, unless it will be MEC Myth, but my understanding was it is Dr. Zungu. Eastern Cape.
Thank you so much. Good evening. It's going to be the MEC. I am Noma Kosoganameth.
Thank you, MEC. Thank you so much.
Thank you so much, Minister, and the viewers. I appreciate the opportunity and my colleagues. As the Eastern Cape, we are at 67% in terms of the vaccination of our healthcare workers. We have seen high interest now, numbers coming up as we went towards closing our phase 1, which will still continue to do that to finalize our healthcare workers. As an honorable minister has said, we are starting tomorrow. We are ready with our 25 vaccine sites, but we'll be starting with the 18 this week. And they are all over the province. And all our vaccine sites have the cold storage at -20 degrees, except for 2 at Bishop and Grey, where we've got 2 to 8 degrees freezers. Again, we are working with our private partners, in particular the tertiary institutions. So we have covered the central side, the western side of our province, working with roads. They have assisted us with the -70 degrees freezer, which will cover the western part of our province, but the central part to get the -70 freezer at Nelson Mandela Research Center. We've got 40 old age home places where we are targeting to help our people. We are going to be going there. We'll be moving with our mobile connectivity gadgets to make sure that, like routers or 3G or 4G cards, to make sure that we are not interrupted by issues of connectivity in case it may happen that in the old age homes there is no connectivity. We are also having our ICT people close to us so that if there is any intervention that is needed, you can be able to move with speed to make sure that there are no interruptions. Another strength that we are having as a province is that in our facilities, we've got the backup in the cases where there is power outages. We'll be able to continue keeping our vaccines at the required temperature levels. Also, we procured cooler boxes, which are -2 to 8% to 8 degrees in terms of the temperature, so as to ensure that we don't break the protocols and the rules of the COVID-19 vaccine, that in particular Pfizer, the temperatures that are needed there. We appreciate the work that we are doing in the partnerships with our sister departments, because we are working with the Department of Education, we are working with GSD and SASA, and also our private sector is working with us. We are engaging our traditional leaders, they are on board, and the religious leaders, and we are having a plan to go with the prominent leaders to be crowd pullers to assist us to serve as an example to show our people that administering this vaccine is something that is good to do because it is safe to do it. We've got also we need about 49 -20 freezers, and National has verbally promised to supply us with one -20 freezer per municipality. We are following up on that because we still need more, even though as we speak now we've got about 25 minus the 2 that I've mentioned, that it's 2 to 8 degrees Celsius. We are having we're using the couriers. Madibana covers the west part of our province, and Skynet, which is covering the east part of the province. And we have decided that we are not going to be taking our vaccine to the depot, but we'll take it straight to the sites so that we eliminate any glitches and make sure that everything is moving with speed. And we are having our security as a backup to make sure that all our deliveries are escorted. We are already having more than 174,000 older than 60 years who are registered. and we continue to see our people coming forward using all the available platforms to register. We have, as a province, established a war room to coordinate the work that we are doing that meets every day, so that in terms of logistics, we are able to interact with the people who are directly on site. And the partnership that we are getting also from our municipalities is making our work very easy, because even the executive mayors, as we speak tomorrow, they've already targeted places that they will be visiting. Across the province, all the district municipalities and our local municipalities are working with us. We've got municipalities like Alfredo that have mobilization trucks. Our Nelson Mandela today, work to see how ready we are, and also grow. And everything in our province, we believe, is all systems go, and we've got the infographics that we are distributing to our people, and we'll be having meetings this week with the business sector, with the religious leadership and the taxi industry, because we are targeting the malls, we are targeting the taxi ranks and the churches and community halls, and even our clinics and community health centers will be used as we start to progress, starting from the other week, where we are expecting to get a total of 43,000 vaccines, because for now we've got 16,380 that we received yesterday, but we are promised that we'll be getting additional doses, which will make a cumulative amount of 43,000. So we think as a province we are ready, and our people are showing interest in coming and getting the vaccine. Thank you so much.
Well, thank you very much, MEC. We really, really appreciate that input. We're going to move on to Free State. May I humbly request all presenters to kindly try to keep their presentations to 5 minutes, as we do have quite a lot to get through. May I check if the MEC or the HOD, or it is the MEC too, if the MEC is ready? I know that MEC was using HOD's machine. But,
yes, thank you.
Yes, thank you, MEC. Thank you so much. Please take the floor. Thank you.
Thank you very much. As the Free State, we are also ready to roll out tomorrow. We are opening 2 sites in 2 different districts. The district in Mangaung, we are opening the old age home. We are targeting, in fact, next week we are targeting the old age homes. We'll be in Mangaung at Bihucho Old Age Home. And the second site that we are opening is in Thabo Mofutsanyana, that is the Tekolehelong Old Age Home. We have already received our the vaccines, and so we are ready to start. The total number of the population that we are targeting for this phase 2 is 288,220. At the moment, the total of the people that have registered thus far is 37,741, and we are continuing with the registration, and also we are doing the unique way in encouraging people to register, that we are doing loud hailing in the townships, and also we are using our own community healthcare workers to do door-to-door. Red Cross is also helping us. Our other partners like the social development is also helping us. The Right to Care is also helping us. We are also using the community radio stations in also teaching people who can register with their own smartphones online at home. Because we want to get as many people as possible registered. We will be actually starting this week with the 2 districts. The other districts will wait for us to receive the more doses of the vaccine so that they can also roll out. But they are ready. As far as the registration is concerned, all the districts are continuing with the using the community healthcare workers to do the door-to-doors and to register. There's a truck that we have hired that we do the campaigns of ensuring that people do register with it. And we have from Tekolehelong in Thabo Mofutsanyana, that in the coming week we will be moving to other old age homes in Harrismith, in Pietersburg, and also in Reis. And in Mangaung, it will be in Tabanchu and Botshabelo. And those are the places where we have more old age homes. Now what else?
MEC, may I take this opportunity during the pause to ask for just 1 more minute?
One more minute.
Yes,
okay. We do have the sector leaders that would be also getting the vaccines tomorrow. The mayor and the traditional leaders in Qwaqwa will be joining us in Tekuluhelo to get the vaccinations. And the premier will also be with me in Tekuluhelo, and in Mangaung will have the MEC for Social Development joined by other MECs there at Bihucho. Yeah. We really are ready, and we are continuing with the healthcare workers. The sites that were open for the healthcare workers will continue opening, and the healthcare workers that have not been vaccinated, because we have so far vaccinated 24,000 and we are left with 12,000 because we've got 36 healthcare workers that we were supposed to vaccinate. So we will continue vaccinating them for this week until the end of this week. Thank you.
No, thank you very much, MEC. Much appreciated. Let us invite Gauteng. I don't know if MEC Mkhize is ready or if the HOD will be coming through.
Thank you, Chairperson. My name is Nomsa Mobe. The MEC has requested me to represent her as she's not feeling well today.
Well, thank you very much. However, may we request that the video comes on if possible, as we are live on television. Thank you very much. The floor is yours.
Thank you very much, Chairperson. As Gauteng is all systems go, we are ready for tomorrow. Can you see me, Chairperson?
Yes, ma'am, we can.
Oh, okay. Sorry about that. I was saying that as Gauteng is all systems go for tomorrow, we are ready, all our sites. We've been making them ready over the period of time, and we've been monitoring them from time to time to ensure that they are ready for tomorrow. As at yesterday, Gauteng had vaccinated just over 127,000 healthcare workers under the Sisonke program. The remainder, which is 88,727, will be completed during this phase using the Pfizer vaccine. Over and above the healthcare workers for this phase, we also are going to add the traditional health practitioners as well as funeral parlor workers. They'll form part of this phase. So far we've got 291,000 people that are registered on the EVDS, and these are people that we hope to vaccinate over this period. We have received as Gauteng 10,530 doses, and these have been allocated each per district. So each district knows how much has been allocated for them, and they have subsequently distributed them according to the sites that are going to be vaccinating. We have established 29 Pfizer vaccination sites just for this purpose, but we will add additional sites from the 285 that were already made ready as we scale up the vaccination program. So we are expected, as part of phase 2, vaccinate 1.3 million of persons that are up above the age of 60 years. And we have a capacity of vaccinating 36,200 people per day. Over and above what we have established, we have got the private sector that's also coming on board. 9 sites have been established. These come from GSCAM, from CLICS, from ICPA as well, to assist us to top up, but they will be vaccinating their own, especially those that have got medical aid. We have got 218 old age homes that we've targeted for this phase, and they have a total population of 26,216. We have got 2,445 vaccinators that will target the healthcare workers as well as the people in the old age homes. We have trained over 5,000 and continue to train vaccinators on a daily basis. So we have got also 5 sector leaders that have been deployed to our province. They will also be there tomorrow when we launch, so that they help with inspiring confidence and also increase the demand for vaccination. We are also using various media platforms to encourage and persuade registration and also inform people of the vaccination programs. We've also established a hotline for this purpose to take the inbound and outbound calls. The hotline's number is 0800 228827, or you can email us at support@gauteng.gov.za or hotline@gauteng.gov.za. Our website is gauteng.gov.za, or alternatively, the easiest way to reach us is on WhatsApp at 0826011000. So we are using community health workers, community development workers, local councillors, our ward-based outreach teams, traditional leaders, gender-based violence brigades, and labor movement leadership and teachers to support us in the registration campaign. We also have got MECs that form part of this. They have also been deployed to the sites tomorrow to assist with the vaccination and the launch of the vaccination. But in Gauteng, all I can say that with all systems go, what we are requesting is people not to come to the vaccination site if they've not been scheduled. However, we do anticipate that we will get people that will come, and as and when they come, we will assist them on site with registration and vaccinate them. Thank you, Chair.
Thank you very much. Let's move on to KwaZulu-Natal, and I think I did see HOD. MEC, my apologies. You are here. Thank you very much. Please do come through, MEC. Thank you.
Good evening, Dr. Manzi. Good evening to the Minister, the Deputy Minister, and colleagues and viewers at home. I will try and be very quick in my 5 minutes that we have been given. Indeed, as the province of KwaZulu-Natal, we are ready to start with the phase 2 of the vaccination tomorrow on the 17th, and as indicated by other provinces, it will be a phase-in approach that we are going to be embarking on. We have concluded close to 100,000 vaccination on the health workers, and we are remaining with about 60,000 that we still need to conclude, and we believe that those will be concluded in the next 7 days. And that program or process will run parallel with the starting of the phase 2 of the vaccination. Let me indicate that for now, in total, we have identified more than 600 vaccination centers in the province. And this is when we will be rolling out at full scale up to phase 3 of the vaccination. However, understanding that we have to have a phase-in approach, we will then start with the first 27 sites. Let me also indicate that the 600 that I'm talking to also includes community halls and community centers that we are going to be utilizing later on in the year. But the first 27 sites have been prepared for this purpose, and those include our own facilities as the Department of Health. In other words, all the clinics, all the hospitals and the CHCs in the province will be utilized. So in all the 11 districts, including the metro, our hospitals are going to be ready. Again, we also want to make a call that unless you have been invited, please do not come. But those that do come in will be assisted on site, and we have a number of programs that are indicating or a number of programs that are assisting the elderly on how to register. Dr. Manzi, we have a very long list of our own hospitals, and I think it will take most of my 5 minutes if I count them. But I do want to indicate that in Herikwala, because there's just one hospital there, will be utilizing Asha Memorial Hospital, Ichi Asha Memorial Hospital. LMB will be using Umpumulo as of from tomorrow. Uku, it's GJ Cruz and Potchefstroom. The list is long, and we are going to be tabling this particular list. We are also going to be visiting old age homes, but in the province or in the province of KwaZulu-Natal, we don't have old age homes in all the districts. we have old age homes in 8 of the 11 districts. Amajuba will have their old age homes visited. King Cetshwayo district will have their old age homes visited. Umgungundlovu, Ugu district, Zululand, Umzinyathi district, Ilembe district, and mostly eThekwini metro, because that is where the bigger chunk of our old age homes are based. I must indicate that because eThekwini has the biggest number, we will then start with the old age homes tomorrow, but the vaccinations will continue to the 18th, the 19th, and the 20th, because there's about 15 old age homes in that district alone. So the list is going to be advertised, and we've already started putting it on social media. We have posters that we have put up, and we will be putting those up in the newspapers. We'll be putting that in our own social media space. We have a lunchtime chat that we are running weekly, and we will be updating the community on a weekly basis on which sites are open when, and when people can continue to come. I see you have opened and we are about to actually stop me, but I must indicate that we are quite ready. We've also made sure that the storage and the security of the vaccine is secured, Dr. Manzi. Maybe let me just stop there, because I have spoken to the issue of communication. We will be loud hailing as well. Thank you very much.
No, thank you very much, MEC. I do see that there are some requests for the sites to be published. They will be published quite widely, both on national platforms and, as the provinces have said, across many, many platforms. So the sites will indeed be published. We won't be able to...
We'll also provide you with our own list.
Yes, no, thank you very much, MEC. Yes, we won't be able to put all 87 sites right now. And of course, as we all know, the sites will be expanding as the days go along. I see that MEC Ramathuba is ready for us. Therefore, MEC, the floor is yours. You do have 5 minutes. Thank you, MEC.
Good evening, and evening to the Minister and colleagues. Once more, we really appreciate this opportunity just to firstly appreciate our participation through Sisonke. We've been able to vaccinate a total of 33,227 healthcare professionals, and we still have more to go to reach the 59,000. That is inclusive of all the public sectors and the private sector healthcare workers. Our total sites that have been identified from the public sector for vaccination is 37 sites, which will be operating during weekdays. Of those 37, only 6 have been identified for this week to be focusing on the Pfizer. The 37 were all ready to can start with the Johnson & Johnson, but because of the logistical requirement, we have got only 6 sites to start with the Pfizer, because you will remember that we need to store it for 14 days at minus 15 degrees and 2 to 8 degrees at 5 days. So what is currently happening in the province, we have got 400 of the WHO approved fridges, which do cater for those temperatures that I've already indicated. We've already received the temperature monitors, 110 out of the 500 that we have ordered. And in terms of the cooler boxes, we have got around 69 that are available and ready now to can go for an outreach. We already have 17 primary healthcare facility sites, which are also fixed sites that are ready for Johnson & Johnson. Then what is going to happen tomorrow is that the Premier will be leading us, and one of our sites, 2 sites will be working for Pfizer tomorrow, which is Mkokwani and in Waterberg district, and CN Patudi in Mopani district. We have received a total of 8,190 dosages as of this evening. Today we received around 2,340 from TSB. BioVac delivered yesterday 5,850. So we are ready this week. All the 6 sites will be up and be vaccinating. Then for the following week and also this week, we have identified 3 old age homes from Upani, Waterberg, and Capricorn. The second week, we will continue to identify. And I think colleagues must remember that our plans continue to change on a regular basis determined by material condition. If we receive a J&J vaccine, it will definitely change. But if we continue with Pfizer, it will continue because, as I've indicated earlier on, logistical requirements. We have got 91 teams that are ready for outreach, which are moving towards different areas where they will be assisting with the vaccination. We've already met with the House of Traditional Leaders so that they can commit their support. They've already committed their support, and you will see some of them this week leading the vaccine site, because we don't want to be only politicians, but we need the leadership across the society. We've already met with South African Council of Churches. You will also see their leadership leading to be receiving the vaccine and also talking the message. Tomorrow, as you know, our province house 2 big churches, the ZCC churches, which on behalf of South Africans, we need to also appreciate their support to say for this, for last year and this year, they've been able to sacrifice, and it's history that in Limpopo we did not go to Moria. We did not, because of the respect and the support for our struggles to fight COVID-19. We really appreciate, because if you had not supported us, we will be talking a very different language as the people of Limpopo and the people of South Africa and the continent, because our churches attract more than millions of worshippers across the continent, even across the globe. In terms of registration, we have made strides. Up to today, we had registered more than 180,000, and we are appreciating all our initiatives, which started with the Premier, who led the senior citizens to, on the 21st of April, to register, followed by us moving to different community, and our community of healthcare workers doing door-to-door, assisting with the registrations, and also our churches and the structures that I've indicated we have met. They are also assisting us in terms of helping with the registration, and we have seen it assisting. In terms of partnership with the private sector, what I can indicate is that for the 3 private hospitals that we have already received the full report from one of the facility, especially the Netkepuluso, that they are ready. They will be receiving their first dosage to vaccinate the public from next week, Monday, and targeting having 7 vaccinators per day and targeting between 500 and 1,000 people on a daily basis. We are still waiting, especially when it comes to the pharmacy, your discount, your clicks, because we need to understand their plans. Our challenge here, which we have been asking them, is to say, because unlike our private hospitals, which are well organized, we do not have that organized structure that we can be able to deal with at a provincial level. Our main concern here is when you look at the queues, how are we going to manage in terms of the spacing and all that, because some of these pharmacies that have been approved, when we visit them, we realize that in terms of infrastructure and the place to be able to vaccinate, it becomes a challenge. But those are the issues that this week we will be dealing with them before they start vaccinating, so that we are comfortable that every vaccination site, whether it's public or private, it's still the vaccination site within the Limpopo province, and it should not be seen as a super spreader. Otherwise, I can see, Lwazi, you want me to cut me. I will, if there's any question, will answer, but I still had a lot to say. Thank you.
Thank you very much, MEC. I do apologize, but hopefully we can maybe cover some things during the Q&A section. Thank you so much. Let's move on. I see that MEC Manzini is ready from Mpumalanga. Thank you very much, MEC. The floor is yours.
Thank you very much, Dr. Lwazi, and greetings to the Minister, Deputy Minister, MECs and HOD, and also to the viewers at home. As in Mpumalanga province, we launched a vaccination program on the 19th of February, where we managed to a total of 51,156 healthcare workers were planned to benefit from the program. But so far with the Sisonke, we managed to vaccinate 20,488 healthcare workers, and they've benefited out of that, and 30,668 still to be vaccinated, which include, of course, our healthcare workers and also the traditional healers. So the Sisonke program ended yesterday in the province, and the department and the province will take over as far as the Pfizer is concerned. And this will mean that we will be now moving to phase 1 and B and 2 that will run parallel with a total of 333,001. These are elderly people above the age of 60 years in the whole province, and they're expected to benefit during this phase. The province will initiate these 2 phases in 6 hospitals, which is in all the district. The approach is that we are going to Tanzania will use Rob Ferreira and Shongwe, and Kharsibande, Emelo and Betal, and Kangala will use Witbank and Mediplex to implement first. Then in terms of kickstarting the phase 1B and phase 2, a total of 7,020. This is the number of doses that we have received as a province for now, and we are going to start in Rob Ferreira, Shongwe, and the BioVac distributor that we are going to use, and also Betal, Emelo, Witbank, and Middelburg. The province will receive weekly deliveries, but so far this is what we have, meaning that as a province we'll be able to only from tomorrow use the 7,000 that we have received. Phase 1 and B and 2 will start on the 17th, and the 6 identified. But also the approach of the province is that let us conclude as far as healthcare workers are concerned. Those that have registered will start with all of them, and then at the same time starting with the senior citizens that have registered in the system. But however, our systems are in place to make sure that those that come and they have not registered, they will not be turned away, they'll be assisted, because you'll understand that it will be difficult for adult people to come twice while want to be assisted. A total of 49 congregate settings, our old age homes, have been identified so far, both registered and unregistered in the 3 districts that we are having as a province. And a total of 3,308 senior citizens reside in these settings. But our approach is that as a province, will also go to the communities and the wards and start with adult people, because the number is, as you can see, is very low for us as a province to only focus on that. The province has also prepared 1,108 sites that will be used as mass vaccination sites, of which we ensure that in each and every municipality, the ward, there is a site to ensure that our community members don't walk long distance to access the vaccine. And we'll also start ensuring that we reach out to this site as we are assisting those that are in old age home. In terms of our plan of the rollout, we also have got outreach work-based vaccination program. And this platform will be used for communities that are far from health facilities or unable to access fixed site. Here, mobile teams will be moving from one vaccination point to the other to assist. And also community structures, we're working very well with the municipality. We'll make sure that sites where vaccination will take place, like your creche, churches, community halls, sports ground, traditional authority offices, congregation settings, shopping mall, and all these places that were identified. And as a province, let me indicate that we managed to train 3,321 vaccinators. And in terms of these numbers, it will tell you that when we're doing our calculations, one vaccinator is able to do at least maybe 50 a day. And looking at our population as a province, it might take us even less than 10 days if we get all the vaccine to make sure that we are able to vaccinate the people of Mpumalanga. The 6 vaccination sites have been identified to start with phase 2, and we can indicate that there are following hospitals in all the different districts. I'm not going to name all of them, but there are all hospitals in all the districts. But maybe also to indicate that as far as to cater old age home within their district, Etlanzeni will use Rob Ferreira and then conduct, of course, outreach services in old age home, Kharsibande, the Emelo, those that I've listed, and also in Gangala. And let me also indicate that we also identified Rob Ferreira has selected, as far as vaccination, all the general population above the age of 60. And the scheduling system will be used to avoid stampede at vaccination site, while walk-ins also will be accommodated, as I've indicated. Outreach teams will also be there. We are using radio slots ongoing, and social media and newspapers messaging is in progress. And also we started to assist all people, and also we are encouraging young people to assist their older people, and also ward councillors, executive mayors in their respective municipality. We have seen other mayors like in Bushbuckridge assisting to register, and this is what we are going to continue. I can see, let me indicate that in terms of the 7,000 doses that we have received, we are going to roll out. It means that in a day or two will be concluded, and as I've said, that one vaccinator is able to vaccinate over 50. So that on its own, it means that as a province, we are ready to make sure, even though, of course, the challenge that is there for all provinces of your fridge and all that is something that all of us, we need to look at moving forward. Thank you.
Thank you very much, MEC. Much appreciated. May we invite MEC of Northern Cape, MEC Legwene. The floor is yours. Thanks, MEC.
Good evening, Dr. Lwazi, Program Director, Honorable Minister, Deputy Minister, Head of Departments, colleagues, MECs, general viewers in the media. By yesterday, which was the 15th of May, with the Sisonke program to vaccinate our healthcare workers in the province, we have reached by Saturday, 15th, 77% of the targeted numbers, which was 13,000, which translates to 9,219. As a province, we will start phase 2 vaccination rollout program tomorrow at 8 o'clock at the Harmony Home, which is our primary site in Kimberley. Currently, we only have one site, which will be operational this week to vaccinate over 60s in the province. By end of this week, our intention is to have opened 2 extra vaccination sites, which will have 3. Within next week, we're supposed to be having 5 vaccination sites running fully. With regard to the self-restriction system, 11,000 of over 60 years have registered in the province and ready to vaccinate tomorrow. We can confirm that there's a total of 3,887 of these over 60s, which are based in Salt Lake, which is the Kimberley area. By yesterday, I must report, Honorable Minister, and thanks very much. We have received our first batch of 3 trays of the Pfizer vaccine. With these doses, we will be able to vaccinate 3,510 of the 3,800 over 60s in the province tomorrow in Salt Lake, Kimberley. We have a total of 220 vaccinators for the province, of which 77 of them are located in the Transvaal District Municipality. Our vaccinators have been trained and are ready to vaccinate so that our mass immunity can be achieved as soon as possible. This week, we hope to complete over 60s in the old age homes in Salt Lake Municipality. Our preferred plan is to then move forward with the people in other congregate settings. After this, we would like to progress to people under 60 living with the comorbidities. Harmony Home will be used to vaccinate the remaining registered healthcare workers, as I alluded before. At the same time, tomorrow we will be deploying our mobile teams to the old age homes in Salt Lake. For now, we have targeted 8 old age homes. Other areas will also be targeted this week. Around Salt Lake is the West End Hospital, St. Teresa Hospice, and the New Mental Hospital. I must report that the registration drives to encourage people to register is on track. We have been crisscrossing the province, conducting door-to-door where possible in various communities to create awareness on the importance of vaccinating. The strategy has also assisted to ensure that over 60s are not left behind when coming to registering on the EVDS, so that we also assist our aged. This is in the main has assisted the province to deal with vaccine hesitancy and correct misinformation about the vaccines. This week, we will be targeting Francis Bar broadly and Pixlega District. Our primary focus is Francis Bar District, ZFM Kankau District, and Pixlega District, which will be targeting for for a mass inoculation. And we are using the engagements with SASA and other departments to promote restriction over our 60 and overpopulation. But also, our concern as a province is the number of the new infections which have increased over the past few weeks. Of course, it indicates that we have to deploy intensive containment measures in addition to an increased testing to improve our tracking and tracing of the infections. But also, our systems are in place, including a generator in case of any load shedding, but also we have our Provincial Vaccination Steering Committee, which is led by the HOD, Mr. Rian Stradom. And as a province, we are in a position to adapt to any situation given any changes. We must also make the point that we will be opening a minimum of 30 primary vaccination sites across the province, especially when the Johnson & Johnson vaccine arrives. For now, we are opening Kimberley for the start of phase 2. But also, we want to also thank the Minister for really considering to prioritize Northern Cape Province for the Johnson & Johnson vaccine. And lastly, we can report that all systems go and we are ready. So tomorrow we'll be starting at 8 sharply to kickstart the second phase of our rollout vaccination program. Thank you very much, Doc.
Wonderful. Thank you very much, MEC. And let's move on to the Northwest, the province where all the gold and diamonds get mined. MEC Sambata, thank you so much. Please come through.
Thank you very much, Dr. Loaz. Of course, the issue of mining, sometimes historic in some instances. Thank you very much, and the listeners. Northwest, we are dealing with a program on two-pronged basis. Two-pronged in the basis that we are finalizing the vaccination for healthcare workers. In this instance, the registration in EVDS is 44,000. And those that had taken vaccination up until yesterday, it's 23,100. So the process of further finalizing vaccination for healthcare workers still proceeds. And we must make a call to all of them that with effect from tomorrow, there's no need for a voucher for a person to access vaccination. They must just stand up and come to facilities. And in this category of healthcare workers, we will start immediately at 8. Theirs, it's 8 to 4. The second phase, which is the current phase of phase 2, it's vaccination for people above 60. And in this instance, those that are above 60, the program would start between 12 and 4. And it's going to be working on scheduling. Walk-ins would be allowed in actual fact. When that program starts, we will prioritize communities or our people at 60 and above. That's the second process. On this one, it has 3 elements of registration. We have an issue where we're encouraging families to do family assistance on registration, and we're encouraging people to go to facilities of health nearest to them. We are also doing outreach campaign-based registration, which means through the House of Traditional Leaders and in terms of closest traditional offices to communities, we do registration and we do campaign-based registration so that the number of registered must keep growing, so that in the last phase of the program would have registered at least a greater number, for vaccination would do a greatest number. Then the third element, which some provinces may not be focusing on, in the province, we are dealing with vaccination concurrent at a period where our numbers of COVID-19 positive cases are increasing on a daily basis. Therefore, we have a responsibility to ensure that whilst we are dealing with vaccination, we also deal with COVID awareness and requirements expected to manage COVID-19 positive testing cases, so that our numbers, though they grow, our response must even address to that. With effect from Monday, we will be starting with 5 sites for vaccination, which is Moses Kotane Hospital, Job Shimankane Hospital, Brett's Hospital, Veteran Hospital, Klerksdorp Tsepong Hospital. But with effect from Tuesday, we will be joined by extra 5, which means our province will be running 10 sites during the week, which is Ventersdorp Community Health Center, Mafikeng Provincial Hospital, General Dilare Hospital, Zirast Hospital, Freiburg Hospital. So all our districts will be covered in terms of accessing vaccination for 60 and above and vaccination for healthcare workers. Remember, on this element of 60 and above, there's 60 and above in old age homes, which that one we're working jointly with social development on the basis of a partnership to ensure that both of us have accessibility in all of them. Of course, we have received our vaccines, 19,000 vaccines received on the age above 60. As we speak now, we have registered 59,344 with effect from a week after this one, Monday. We are going to be having campaign of door-to-door on registration because some of our communities do not have access to network. For instance, there are areas which are bordering Botswana where when you go to them dominantly, the network, it's a Botswana network, not a South African network. So those areas we are going to dedicate much time on door-to-door registration. We have a partnership. We're not working alone as the Department of Health. We're working with social development and SASA. We're working with traditional leaders in our province because most of our communities are covered by traditional authorities. And we work with Command Council. In traditional authorities, remember, when you reside there, something that comes from a traditional leader, people in our province will ask you, Khoshi Aringena. So when you give a word through Khoshi or a traditional leader, it's a word that is believed too much in our province. Our request officially is that our people in the province must not lower their guard and assume that because we're in vaccination, therefore, COVID preventative measures should not be entertained. And that's the reason why we end up having increasing numbers, yet it's in a time when we are vaccinating. That's what we have as a province throughout Northwest. 10 sites from Tuesday, 5 from tomorrow, 5 coming up the next time. Our sites are registered on both static and outreach. The reason it's on the basis that we want to extend accessibility. People must not be the ones who are looking for vaccine. They must register to vaccinate. The vaccine must be delivered to them to areas where close as possible by the provincial government in ensuring that the national distribution and national coverage is therefore realized on the basis that the most vulnerable people should be the most ones who are attended on the basis of outreach provincially. Thank you very much.
Thank you very much, MEC. Thank you so much. And last but certainly not least, let's go to the Fair Cape. And I believe that MEC Mbombo is standing by. MEC, Western Cape.
Yeah,
thank you very much, MEC. The floor is yours.
Okay, thank you. Starting with the healthcare workers, the finalization of the phase 1 for the healthcare workers, we have completed, vaccinated 153,000 healthcare workers, both public and private, from the Sisonke vaccine. Meaning now for those who are remaining is the ones that we'll be starting with on the 17th. There are 10 sites in the metro where the healthcare workers now will be completed with a Pfizer. In regard to the phase 2A, which is the older persons, we are starting in the metro gradually. In the second week, we will be in the rural areas. The overall number of sites for the phase 2 currently is about 274, of which is 270 will be in the metro, and also the others, the remaining ones, will be in the rural. In the metro, we also split it according to the sub-district that is in the metro, which is we've got about 8 of those sub-districts that are happening. Just making an example in regard to the rural, we've got the Overberg district where we have got 48 sites, Garden Route, 41 sites, the West Coast district, which is the largest but fewer people, 53 sites, the Cape Winelands district, 48 sites, Central Karoo district, we have 14 sites. Noting that gradually there will be private sectors and also workplace sites that will be added. We will have the weekly updates in regard to that space. 3,113 of the vaccinators, they've already been trained out of the 5,000 that have already volunteered. And it is crucial, we want to understand that from the 17th this week, we are starting for the phase 2 with the old age homes and also those in the long-term facilities that will be attached to these facilities that I have mentioned. Making an example, in the Khayelitsha Eastern District in the metro, we have got about 7 old age homes that will be part of this. In the Klerkfontein, which I was playing, there are about 6 of those. And the southern and western, we've got 1, and then others will be phased in the second week. Similar with the northern and Tygerberg district, that will be phased in. In regard to the registration, out of the 720,000 plus of the older persons over 60-year-olds in the Western Cape, 226,137 have registered. That makes it about 30% of the population. And when you split that according to each and every district, you'll find that Metro is about 29% registrations. And the one district that has registered most is the Overberg at 51%. Hence, we urge people to assist in their registration, assisting the elderly. As we always do in regard to the innovation, we have introduced a dashboard that will be populated as soon as possible, where one can see each and every area, how many elderlies that are there across, and also what is the distribution of the elderly, especially in high levels of socioeconomic areas in regard to the vulnerability, because we don't want to leave anyone behind. And also look in terms of the estimated elderly population within a 1 to 5 kilometers radius in regard to the vaccination site, because we have to make sure that there is no long distances that needs to be walked. Also, where should additional support be provided to improve registration, and also what are the surrounding footprints of social facilities like the Wi-Fi. Talking about the Wi-Fi, and also how to make sure that the elderly do get registered, because most of them, they don't even have, not only the phones, but also they're even not aware what is happening. Hence, thanks to the City of Cape Town, where they make sure that they are all their libraries, which is most of them, they've got access to Wi-Fi. Anyone can be able to go there if one can be able to make use of the phone or whatever device and access the Wi-Fi. Or you could also bring that person there will be people who will be able to assist you, because our libraries, they've got very space in regard to, in terms of the access. Similar, even in partnership with the Department of Education, where many schools also have got Wi-Fi, where the elders and also the households who do not have access, they could be able to have an access, because when you go nearer to the school, you could be able to access those. But it is crucial that the children, the bundles of joy, can be able to access the grandparents in regard to access all of those in terms of the Wi-Fi. And of course, the face of the leaders, community leaders, specifically the faith-based leaders, are the ones that also where we want to encourage them to make use of them so that to reduce the element of vaccine hesitancy, because we have seen that lessons learned from the phase 1 on vaccine envy, when you see other people are getting vaccinated. So that's why we're excited that Archbishop Desmond Tutu and his wife, Umama Ulea Tutu, will also be vaccinated along with other religious leaders as we kickstart tomorrow our vaccination. Leaders coming from the different churches, Catholic, Anglican, Moravian, Dutch, and all of those. So in closing, we still want more of them, of the elder persons to be able to register. And people must be able also to approach the community health workers, which are going door to door, together with some of the community leaders and also the MECs and the Premier in regard to making sure that no one gets left behind as we knock door to door everywhere. And then lastly, as I indicated earlier, on the third week, when we have got the extra doses from the J&J, we'll be able also to go into as many as retirement villages. As you know, that Western Cape has got a higher number of the retirement villages and also the old age homes compared to the other provinces. Thank you, Dr. Lwazi.
Thank you very much. And that does conclude all of the provinces, and we are really very grateful to the members of the executive for coming through and tabling the provincial plans. I would now like to invite Martin Kingston, who's representing business through B4SA, to come through and thanks, Martin, and to just tell us a little bit what's happening on the private sector side. Martin, there are some concerns raised about the 4 sites, but I know that it's not going to be the case. So if you can just allay those fears as well while you're at it. Thank you so much, and over to you.
Thank you, Dr. Manzi, and good evening, everybody, Minister and all else on the panel and watching. Tomorrow's launch of phase 2 of our national vaccination program, targeting the balance of the healthcare workers and the over 60s, is a historic moment for us as a country, and it marks a critical turning point in our 14-month fight against COVID-19. We thank the healthcare workers who've toiled tirelessly to save lives over the past year. And I also want to acknowledge the work of the public servants and private volunteers across the breadth of the country who have brought us to this point. Although much has been done, we also realize that we need to maintain the high levels of cooperation and accelerate the scale of registration and vaccination. Business fully supports vaccination, and in respect of COVID-19, we believe it is the best health policy, the best social policy, and the best economic policy for the country. Since last year, Business through Business for South Africa has worked with the National Department of Health and our colleagues in the Solidarity Fund to create the capacity to vaccinate the nation. Thousands of lives and our ability to return to our way of life and ensure that we can put the economy on an optimal growth path depends on us successfully implementing the vaccination rollout strategy and bringing all of our collective resources to bear. As we've heard, we're starting with the most vulnerable, our 5.5 million over 60s, so that they can all be vaccinated by midwinter. As soon as possible, the vaccination program will be extended to the balance of our adult population. The size and complexity of the task has been unprecedented. Never before have we had to implement such a comprehensive exercise, but we are confident that as a country we have the vaccines, the distribution network, the system in the form of EVDS, and the people to ensure that it works well. Brick by brick, this enormous project has been assembled. Everyone realizes the need to commence this phase ahead of the onset of winter and through the third wave. We must complete the program as quickly as possible. As Business through Business for South Africa, we have been proud to work alongside and in support of government as they oversee the rollout of the vaccination program. The work business has done has been as part of the national effort, and I need to emphasize, at no cost to the country. We are mobilizing vaccination sites throughout the country, be they hospitals, pharmacies, clinics, and medical practices, as well as occupational health and safety sites across many sectors, as well as larger facilities. Business has also ensured that we have the people to operate those sites across a huge number of disciplines and competencies. We will be vaccinating healthcare workers from tomorrow, as well as people allocated to those sites by EVDS as soon as possible, but certainly starting from tomorrow. We will have a focused start tomorrow, as we've heard, and we will quickly ramp up our capacity. Over the coming days and weeks, we will steadily and systematically open many more vaccination sites. To put that in context, tomorrow we will bring 13 sites online capable of administering 3,500 vaccines per day, increasing to nearly 40 sites by the end of this week and nearly 80 sites by the end of next week, by which time we should have capacity of over 22,000 vaccinations per day at those sites alone. We are committed to solving any teething issues that arise quickly, efficiently, and comprehensively. At all times, we are working on an integrated basis with government, and particularly the Department of Health, at national and provincial levels. This is the start of a massive national effort. We ask for your support and cooperation. Everyone needs to play their part to get registered, to help others to register, and to get vaccinated, but only as and when directed to do so. Together, we will be able to address the threat that COVID-19 poses to our health, our lives, and our livelihoods. It will then be safe to lift COVID-19 restrictions so that we can resume our way of life, free to practice our faith, socialize with family and friends, return to school or our studies, engage fully in the workplace, travel, and enjoy sport and culture as we used to do. Until then, we must continue to observe the need to maintain social distance, wear masks, and wash our hands. On a personal note, I'm looking forward to receiving my own vaccination, and I call on all to encourage registration and vaccination. It's free, it's safe, and it will enable our country to achieve its full potential. Thank you very much, Dr. Mkhize.
Thank you very much, Mr. Martin Kingston. We really appreciate that you came through with us. So that concludes all of the presentations, ladies and gentlemen. It is now 9:21. I have checked with the broadcasters, and with huge appreciation, they have agreed to carry on beyond past. However, let us not abuse this extension. Let's give 20 minutes for questions and answers. And I believe that there are some who are standing by. What we will do is I will invite about 5 questions, and I will invite the media houses individually. Five media houses, please try to keep it to 1-2 questions each. And please do direct your question to the person that you want to direct it to, so that we can then take all of those answers in the end. And then we'll see how we go for time. We may not be able to have time for more than that. And then we must move to close. And so I would like to invite, I think SABC standing by with their question. Simpiwe, are you ready for us with your question?
Yes, most certainly, Dr. Mkhize. Thank you so much. A very good evening to you, Dr. Mkhize. Good evening, Minister, and all stakeholders. And as well as
if there's a bit of a pause because we cannot get somebody through, we'll just keep moving on. If SABC is not ready to come through, then we will ask that either Eyewitness News or...
Yes, Dr. Mkhize, we are ready. Please to confirm if you could hear me.
We can hear you. Thank you very much.
Okay, great stuff. A very good evening to you, Dr. Mkhize. Good evening, Minister, and all stakeholders, and as well as my colleagues. Now, just a quick question to the Honourable Minister. With less than a day to go before the commencement of the second phase of the vaccine rollout, we understand that none of the individuals registered on the system had actually been sent a notification for an appointment to get vaccinated. And in the same breath, connectivity is still a major issue as the registration process is done online. So you and I know that not everybody has got access to the internet. So how is the department consolidating these concerns in ensuring that no one is left behind and the second phase rollout does not get to a shaky start?
Thank you very much to SABC, Simpiwe there. Can we have ENCA coming through? And if Newsroom Africa is ready, you may also come through while we wait. Eyewitness News, Mahlatse or Meerlendek? Okay, colleagues, because we're going to move on. Minister, may I request that Minister answers that question, and I'm going to see if I can get the other broadcasters through, or I will ask the questions on their behalf.
Dr. Lwazi, I don't know if you can hear me.
Yes, I can hear you. Thank you. Thank you.
It's Thabo Mdluli here for Newsroom Africa Channel 405. Minister, the question for you tonight is around the rate at which we are preparing sites. Currently, I mean, if we look at the numbers that were presented by the various MECs, we are sitting at 2.6% of the sites ready to operate. How long are we going to stay at that level of sites ready to operate? And what is the reason that they are sitting at that level at this particular point? We hear from the private sector, they hope to get by 2 weeks at 80 sites already operating so that the numbers can quickly go up to being able to vaccinate at least 22,000 people a day. That is not something that would be possible for the public sector at this particular point with those numbers. Thank you.
Thank you very much for your question. Let's check if ENCA is ready to come through, or Eyewitness News. Okay, I think let's ask the Minister to come through with those two questions. Minister, thanks, and then I'll just check with the broadcasters if maybe I can assist them with their questions. Thank you, Minister.
Thank you very much, and thanks for the questions. Let me start by saying that there are quite a number of questions that are on the platform that are being responded to. At this point, I'm aware that they've at least answered no less than 36 questions on the one platform, and the others also are getting attention. So please feel free to raise your questions on the platform. The question is, there is less than a day before the start. There are no SMSs sent to people. When I started, I indicated that we were releasing tonight the 7,000 SMSs to the health workers and about 4,000 to the citizens over 60 years. So we would expect that the messages would have gone out. But because we have already registered 2.1 million people, that many people will say they've not seen the SMSs simply because they've not received them, because we were only starting with a few people. What we learned from the Sisonke study was that you need to give a bit of time when you start so that you don't get immediately overwhelmed and then scale up as we go. Just a simple question of getting used to the vaccinators, mixing the vaccine and taking it out and injecting the person, just to get the hang of it takes a bit of time. So you need to actually allow them to build up. Now, when I started as well, I indicated that we are indicated about 87 sites that will start tomorrow. The number is going to increase, and we're targeting close to 200 by the end of the week. And then the numbers are going to continue to increase from that point of view. Where there is no connectivity, we shouldn't despair, because we have got 6 months to be running this phase. So we will actually be having different types of approaches. Firstly, we're starting with sites on both public and private. And secondly, there are going to be major sites and medium-sized sites, and there are going to be sites where we're going to be sending outreach teams. There's cooperation with the SASA, so that in some of the areas we're able to get to synchronize the availability of some of the older persons for both registration and inviting them for vaccination. So we will want to make sure that there's no one who's left behind, whether there's no connectivity or whether people actually don't even have the mobile phones or even aren't able to use them, they'll still be reached. So let us allow the process to start. The numbers are going to be scaling up pretty quickly. The question raised by a newsroom, Thabo Mdluli, that at this rate, how long will it take? We're just giving an indication that this week we'll push the sites up to about 200 by the end of the week, and we're going to be increasing every week. We did say that the peak at which we expect to be doing 250,000 vaccinations per day will be around the end of August towards September, when the numbers of vaccines are going to be much, much higher. What delays us and what takes us to move in the way we're doing is that we have to make sure that our sites open so that the vaccinators are used to the task, that the logistics are also in place, and that we align it to the delivery schedule of the vaccines. So if you look at what we're talking about now, the numbers of vaccines that are being distributed now are really the first batch of vaccines. But by tomorrow morning, we'll actually be having 975,000 vaccines. Allows us to plan better because we know that those are in our possession, and therefore we are able to scale up the numbers. So as we get more and more vaccines, we'll be able to plan ahead concretely with the numbers of vaccines to allow the space to be opened in the sites that have been earmarked. So we would be building this up as we move along. And I do want to thank all those civil society partners who have worked with us. And again, I want to say to our health workers, we have to, come up to this point. Can they make themselves available so that during the course of the week, let's vaccinate as many as possible of them and move on. Thank you very much.
Thank you, Minister. Okay, I believe that ENCA is ready. Edmund, can you just unmute them and can we allow them to go ahead?
Hi there, Dr. Lwazi here. I'm hoping you can hear us now.
We can hear you. Thank you very much.
Fantastic. Thank you. Two very quick ones. On the issue of the cold storage, can you give assurance that at no point will that be interfered with or compromised by the ongoing power outages, especially in the far-flung parts of South Africa? And then the second question is to do with 3 weeks ago, there were reports from Israel where there had been reported links, or in fact suspected links, between the Pfizer vaccine and cases of heart inflammation. That hasn't been confirmed yet, but will you be monitoring that specifically as far as possible side effects?
Okay, thank you very much for those questions. And then Mia, I think that we've managed to unmute you now from Eyewitness News. Please go ahead.
Yes, thank you so much. Good evening, Mia Lindicke from Eyewitness News. My first question, how realistic is the target of vaccinating 40 million people by the end of the year, given the hiccups that we've seen during phase 1 when the trial had to stop briefly with more research on the blood clots? And if it's still on track, what is the national daily target? How many people should we inoculate per day in the country? And then my second question, what is the plan for senior citizens who are incapacitated, those who can't physically go to the sites but they are not in old age homes? Will officials then be visiting them, or how will it work?
Thank you very much, Mia. And I'm going to last in this round invite Adrian Bosson. Adrian, are you unmuted? Are you ready? And if Adrian can you
hear me, Dr. Manzi?
Yes, we can hear you. Thank you very much. Go ahead.
Thank you. Good evening, Minister Mkhize. I have two questions. The first one is that it has come to my information, reliably so, that the electronic vaccination data system had a massive system failure this week, and that in fact you had to bring in auditors over the weekend to try and rescue the system, and that may be the reason why no SMSs have gone out to over 60s. Minister, can you just comment on the status of the EVDS system, whether it's working, and also whether the head of that system has been placed on leave, I'm told. And second question, just in terms of our permits that's been issued for vaccination sites, my understanding is less than 150 permits have been issued out of the more than 3,000 applications. Now, Minister, it is clear to me that you need the private sector to successfully vaccinate South Africa. You're not going to reach your targets with the provinces alone. How can you speed up the issuing of permits, and why has it taken so long for this to happen? Thank you.
Thank you very much, Minister. And there's also support staff, Minister, if you'd like to call on them to answer some of the questions. Thank you.
We may ask DG and Dr. Anban Pillay to respond to some of the questions. Maybe let's deal with the issue of the cold storage, any problems or risk of compromise at that level. And then we can then ask Dr. Anban Pillay and DG to deal with that. And maybe let's allow them to pick up those questions. I'll come in after that.
Thanks. I see Dr. Anpan Pillay is here, and with the Minister's indulgence, we can perhaps also ask Dr. Nicholas Crisp to come through, in particular in regards to the EVDS. Thank you very much. Dr. Pillay, I see that you're ready for us. Please go ahead.
Good evening, Minister, and good evening to the colleagues and viewers. Yes, in terms of the cold storage, we have stored most of the vaccine at strategic points in the country where there is backup generation available should we have problems with power. And within the provinces itself, these sites where storage would happen have been strategically selected so that we can make sure that when there are problems with the electricity supply, there is backup generation available. So we don't anticipate a problem in terms of the electricity supply issues compromising our supply itself. Thank you.
Thank you very much. Dr. Crisp, if you could come through with that EVDS question. Thank you very much. Good to see you.
Sure, thank you very much. Good evening, Minister, and good evening, everybody. No, I think there's some misinformation. The EVDS system has not collapsed, and there has been transitioning out of the Sisonke project into the new project, and wrapping up on one system with a different vaccine and a different way of administration. It obviously has its requirements, but the EVDS system is working fine. There are backups. The teams that are working on various components of the EVDS are confident, and I'm confident that it's absolutely fine at this stage. The sending out of SMS is not related to that at all. It was related to a sequencing of closing one system and opening another system. And we have staff who rotate on leave from time to time because it's been a stressful and tiring environment. And there's nothing different about some of our staff being off on leave at the moment. And we'll be back at the end of the week. So I don't think there's anything particular to be concerned about. Thank you very much.
Well, thank you. Let me proceed from that. Let me say on the issue of the cold storage and the quality of the vaccines, let me also indicate that it's not just the Department of Health that is dealing with this matter. There's an interministerial team that's overseeing this process. Just this evening, I've been in discussion with the Minister of State-Owned Enterprises, and we're looking at the questions of teams that are overseeing the situation around the ESCOM and the power cuts, so that if there's anything that happens, there's already a team that is able to respond as soon as possible beyond the Department of Health. So we feel very safe on this one. The Interministerial Committee has actually identified this as an area where we must make sure nothing goes wrong here. But the far-flung areas will not be getting Pfizer vaccines, and so we shouldn't have that as a big problem for issues of cold storage. We will actually use largely the Johnson & Johnson, which can actually operate on reasonable temperatures. So we have taken care of the disparities in terms of availability of continuous power supplies into the planning of this. The issue in relation to reports that have come from Israel, let me put it this way. Every day we pick up new reports about different new findings from the different parts of the world. And so we get our Ministerial Advisory Committee to look at those and see when it is necessary to formulate an advisory that we can actually incorporate into our protocol. So as we're dealing with the issues of side effects, we have everyone gets advised that if you have any unusual side effects, just please report as soon as possible. We have a record of what we call the adverse effects following immunization. It's a process which allows us to record anything that is untoward that's associated with the vaccination. And therefore, that is in place. So we're continuing to monitor any other signs and symptoms of vaccine-related or vaccine-associated challenges. So we will continue to do that. The question from Mia, very interesting one. How realistic is the 40 million in 1 year? We have actually said we were determined to vaccinate as many people as possible within this year, but already we have already indicated a number of provinces that have shown that they will actually have to spill over to the first part of 2022 on the first quarter of 2022. So we will actually, deal with this matter as it comes. So we have pushed to say those provinces that can actually be able to vaccinate as soon as possible, they must be allowed to move on. Those that are having challenges must be supported in the process so that let's see how far they can go. But we're already aware that we're going to overshoot into the early part of 2022. We will revise and review as we go along if we think there's a new change that is coming through. So the national target right now is we're going to spill over into the first quarter of 2022. That's where we are. Then the question on the EVDS has been responded to. But let me say that it's a very sophisticated system, this. So every now and again, there has to be a way of making sure that they support, that if they pick up any challenges, any faults, they will be able to respond to it. But I'm not surprised that anyone in that section can actually go on leave. They have been on this job since the first case of COVID, when we wanted this whole system to be set up. They have actually built it from scratch, and there's been collaboration from public sector, private sector, and many of them haven't taken leave. And actually, to be honest, there are many of us who would really love to have a leave. And so if there is a need for any one of the members to take a leave and kind of cool off and come back, would really support that. But it doesn't mean that the system is crashing. It just means that we need to make sure that we keep replenishing our energy levels as the team is moving on. Then the question around the permits, I'll get our team to look into the numbers. I cannot be sure about the numbers of permits that were applied for. But let me put it this way, though, that we do need private sector, but the private sector is not going to be operating completely independently outside the entire system. So they're part of the system. So with the process of building of getting the permits and the question of accrediting will be ongoing, and we're going to be scaling it up as much as possible to make sure that we can utilize as many of them as possible. And with the private sector, they will be getting referral from the EVDS, which means basically the same numbers that we're targeting are going to be handled by both public and private sector. Let me leave it at that. Can we just check if Deputy Minister wants to cover anything that we might have left out? Thank you.
Yes, thank you.
No, thank you very much, Dr. Lwazi. I think not at this stage. Thank you.
Deputy Minister, in fact, I was going to questions and then we can actually start to close.
You want me to proceed?
Thank you. Yes, thank you. Thank you, Honourable Deputy Minister. Thank you.
Thank you very much. Thank you to the Program Director, to Minister Mkhize, all the MECs and HODs who have been on the platform, our business partners, Martin and the team, and all the other role players. Indeed, this has been a long night, but I think very worthwhile. We are indeed entering a very important part of our fight against COVID-19 in terms of moving from vaccination of the health workers into vaccinating the population as a whole, as has been said, starting with our most vulnerable members of society. So indeed, we're looking forward to consolidate the cooperation, the very good cooperation across at government level, local, provincial, national. We appreciate all the cooperation, business, labor, civil society. We're looking forward to continuing this because indeed, and appreciate the media as well, because without your cooperation, without your support and assistance, we would not be able to get our messages across to the population. Maybe just with your indulgence, I just want to favor some members of society who may not have been able to follow, just in 2 minutes, just to say in my local language, ba ka be ba sa kwa gore go bolelwa ka eng re bolela mo ka gore o thoma ka mošupolo gore tla be re bulela meento ka ge re fetša go enta bašomi ba maphelo re tsena sebakeng se ile gore bjale re tlabe re tlhabela moento o go badudi ba Afrika Borwa ka moka re thoma ka ba mengwaga e 16 go ya godimo di-province ka moka di kwala-kwaditše bošegong bja lehono gore na ba lokišitše bjang ke mafelo a mafeng mo go tlabe go thomišwa ka ona re setšhaba ka moka a re theeletšeng dialemoya dithelevishene le bona ditaba ka moka mo baetapele ba rena ba tša maphelo le baetapele ba setšhaba ba tla go be ba re tsebiša gore go hlabelwa kae meento eo re a re tšweleng pele go ngwadiša ba e le gore a se ba ra ngwadiša re berekiša difoune tša rena di-computer re kgopela le bona ba baswa gore ba tšwele pele go thuša bomago bona bopapa go bona borakgolo wa bona le bomagolo wa bona bomalome ba ba thuše gore ba kgone go ka tingwadiša le fele le lebelela gona mo difouneng ka gore melaetša e tla ba e fihla e tla go le tsebiša gore le hono wa bitšwa gore ke tšatši la gago la gore o tle o ente re na le tshepo ya gore re tla šomišana go ya pele bjale mafelelong ke re gantse moento o tšwela pele re se ka lebala gore go itšhireletša e sa le gona mo e leng gore o swantse re go beye godimo re a tseba gore swantse re apare dimaske goba dipipa molomo re hlape matsogo le di-sanitizer gape-gape re efoge go ya mo go tletše go batho ba bantši gagolo-golo mo e leng gore re tlabe re tletše ka mo diphapošing tše e le gore di tswalelegile di sena le go sepediša moya gabotse. We want to thank everybody and we're looking forward. We know it's going to be challenging starting from tomorrow, but I'm sure if we continue to work together, we will be able to see the results. Thank you very much, Program Director.
Siyabonga kakhulu Tawu, sesizocela ukuthi silivale uhlelo, sizocela uKhabazela ukuthi asivalele lolu hlelo lwethu namhlanje. Khabazela.
Siyabonga kakhulu Dr. Mkhize, sibonga kakhulu Tawu nabo bonke abahlonishwa bakhona, sifisa ukubonga kubo bonke emakhaya ukuthi besimemezela namuhla ukuthi uhlelo lwesibili ihlandla lesibili lokunikeza imigomo yokulwa nesifo se-COVID iqala kusasa. Zonke izifundazwe sezikhombisile ukuthi zizimisela ukuthi ziluqale lolu hlelo. Ngakho-ke kuzoqala kumenyezelwe izikhungo ezithile ekuzoqalwa kuzo njengamanje silindele ukuthi zibeke ngaphezulu kancane kwama-80 bese kuthi ngoqhubeka kwesonto kugcine-ke sezifike ngaphezu kwama200. Kodwa sobe simemezela kulabo ababhalisile ukuthi siyabacela beze ezikhungweni lezo. Abangabhalisile sizoba sinceda ukuthi emakhaya kube khona ababavakashelayo noma sicela ukuthi abantu abasha bakwazi ukusebenzisa omakhalekhukhwini bakwazi ukusebenzisa ubuchwepheshe ukuthi bababhalise. Kodwa ekugcineni sobe sibavumela abanye ukuthi uma ngabe ngabhalisile akwazi ukuzizela ngenyawo lapho kubhaliswa khona lapho kuzobe kujovwa khona. Okukhulu ukuthi-ke soqala kancane sengokwenyusa inani labantu abazobe bethola imijovo. Uma usujovile uzojova kanye kulolu hlelo, kuthi uma usuzodinga ukuthi ubuyele bakunikeza ilanga ukuthi ubuya nini uzophinda umjovo wesibili. Bese kuthi kulabo-ke abaningi abasendaweni esingakazi ukufika kuzo sobe sithumela imiyalezo ezobacacisela ukuthi siyofika nini ngakubona. Ngaleyo ndlela-ke sithi sonke masizimisele ukuthi sibhekane nalesi sifo sobhubhane, kodwa sesinayo indlela yokuzivikela ukuthi sisebenzise ukugoma. Noma kusaqhubeka ukugoma kufanele sazi ukuthi lesi sifo sisazosihlupha. Ngakho-ke asiqhubeke nokusebenzisa izifonyo ama-mask, sisebenzise ukugeza izandla nokufaka ama-sanitizer, nokuthi lapho sikhona sime ngokuhlukana singasondelani kakhulu, singabi nendaweni enesiminyaminya ukuze sikwazi ukuphepha kulesi sifo. Sesibonga kakhulu-ke kunina nonke, sizolokhu siqhubeka sazisana njengoba kade bechaza abahlonishwa, soqhubeka nakumsakazweni ehlukene nakunhlelo ehlukene zokusakaza izindaba, senze ukuthi nibe nesiqiniseko sokuthi yaluthola ulwazi lokuthi sikuphi nohlelo lokugoma. Kodwa sithi singayinqoba i-COVID-19 uma sibambisene. Siyabonga kakhulu, suku obuhle.
Singayinqoba i-COVID-19. Siyabonga Ngqongqoshe. Thank you very much, the Minister, the Deputy Minister, the MECs, officials, and of course to our media partners, our wonderful media partners. Thank you so much for staying with us to the end. Viewers at home, thank you very much. And we are going to close the press briefing now. Many, many thanks. Good night.
All right, that was the live briefing there by Health Minister Dr. Zweli Mkhize and as well as other stakeholders about the second phase of the COVID-19 rollout, which will start in the next few hours tomorrow, to be specific. And we've also heard a presentation from the various provincial health MECs about their state of readiness to implement the rollout of the COVID-19 vaccine. And for some analysis, we're now joined via Zoom by the CEO of Proactive Health Solutions, Dr. Fundile Nyati. Dr. Nyati, very good evening to you. Thanks for joining us. Welcome to the Globe. First of all, what are your reflections and thoughts on Dr. Zweli Mkhize's briefing tonight? Dr. Nyati, very good evening to you. Please to confirm if you can hear me.